And thank you so much for joining us on this episode of Family Matters. My name is Purity Museo. Now, one of the exciting, life-changing events for a woman is having a baby, and when you get those test results positive, it's all about excitement and sharing the news with your loved ones. But what next? What are some of the healthy tips of during pregnancy and even after pregnancy? Dr. Maureen Owiti is helping us with that conversation. You do not want to miss. You can be part of this discussion by interacting with us through our social media platforms at Purity_Museo and at KBC Channel 1 News. Use the hashtag Family Matters KBC to send in your questions, and we'll be glad to respond to them. It's good to have you in studio, Dr.
Very nice, and thank you for having me, Purity.
Yes, and pregnancy, you know, it sounds so easy, and maybe a little girl will be like, when I do this, I'll get pregnant. But is it as easy, getting pregnant, is it as easy as it sounds?
Okay, unfortunately, for a few people, it's not as easy as it sounds. We estimate that infertility will be in about 10 to 15% of couples. However, that means there's a vast majority who will get pregnant. So fortunately for a good number of people, pregnancy is something that just comes easy as pie, and they're able to get pregnant easily.
Yeah, I don't know whether we should define pregnancy, but allow me to ask you, how soon can one find out once they're pregnant?
It depends on how zealous you are, but normally when you miss your period, like you have your expected date of the period, nowadays, within a week, if you do a urine pregnancy test, they can turn positive. We say the normal kits that people use, the self-testing kits at home, should be positive at least 2 weeks from the missed period. For us, we count pregnancy from the first day of your last period. So we always get that confusion with patients, whereby I'm telling them you're 6 weeks pregnant, they're telling me, no, I'm only 4 weeks. And I'm like, no, we are counting from the day of your last period. The reason being, we can't know the exact date you ovulated and the exact date that conception actually occurred, whereas your period is a known event. And we know that a human pregnancy is normally 40 weeks from the first day of the last period, and it's plus or minus 2 weeks for a lot of people, other than those who have other complications that necessitate either the baby. From the time we expected you to have ovulated, they can actually be positive at that particular time, because it's going to give us the exact amount of hormone of what we call the beta HCG, and that's the hormone that indicates that a woman is actually pregnant. It's released by the fetus, and that tells us that the woman is pregnant.
And you said it was not, getting pregnant it may not be as easy for some people. Maybe are there some of the things that a woman should do and not do when they're preparing to get pregnant?
And I think that's a new pet topic, and even for us as clinicians, it's something that we're also really trying to get into, and that's the issue of what we call preconception care. Okay, everyone knows that once you're pregnant, you have to go for this famous clinic. But actually, to be pregnant, women should actually start what we call a preconception. Ideally, that should be done minimum 3 months prior to the anticipated pregnancy. So in that type of screening, we look at we'll do a general health screen, rule out any diseases that somebody will have. So do they have diabetes? Do they have hypertension? Look into the family history if there's anything to worry about, and offer the women preconception supplements. The minimum we offer women would be folic acid, which has been shown conclusively to be responsible. So we have what we call a neural tube defect. So that's a very fancy name for these children who are born with either a lot of water in the brain or a hole in the back, what we call a spina bifida. And that group of diseases, we call them neural tube defects. So we can prevent a child having those abnormalities by the woman actually having started folic acid prior to the onset of pregnancy. So we actually do recommend that women should start. And if at all they feel coming to look for us is a bit of a heave, at least be on folic acid if you intend to be pregnant. There are more fancy supplements. I don't want to mention them for fear of looking like I'm advertising. But there are quite a number in the market. But as long as they contain folic acid, women should be able to take that, and that's the minimum. Obviously, we'll also guide them on lifestyle. So to improve their diet, they eating a balanced diet, healthy, the normal that we're always taught in school, lots of fruits, vegetables, drink a lot of water, and all the healthy things that you need to do. Look at alcohol. Can they reduce or altogether eliminate their consumption of alcohol? Definitely for smoking. We don't want women who are pregnant to be smoking. And use of illicit drugs. Those are all things that we go through and try to help women so that she's as healthy as possible by the time she wants to be pregnant. With that in mind, we wish the couple good luck and pray they come back soon enough for a consultation. What we'll say, if they're a young couple, below 35 years of age, we'll tell them, have a year, give it a shot. You're not pregnant in a year, we're here. Come and look for us. And
you mentioned that it's important for a woman to maintain a healthy lifestyle. Maybe you can tell us what is considered a healthy pregnancy and why is it important for a woman to maintain this healthy lifestyle during pregnancy?
Okay. So, like, my husband has been making me very happy. He's been watching this drug Inc. And you see all these young girls, they're hooked on drugs. Unfortunately, it's a pandemic also that seems to be catching up in our part of the world. It's not as serious as in other parts of the world, but it's something that's catching up. Children or fetuses that are exposed to alcohol, drugs, smoking are obviously can suffer some complications. Anything from congenital abnormalities in very severe cases. Some people can even lose a pregnancy, especially if the mother has OD'd, she dies. Of course, the baby's also going to die in that, as in if she's had an overdose. And obviously, there's also like what we call the fetal alcohol syndrome. We have the children are born with drug addictions. So those are not things you want for your baby. And even those who unfortunately are addicted to any form of substance abuse, I'm sure they also want healthy babies. So it's just how to give them that preconception care, lifestyle management, so that they're carrying a pregnancy that's overall going to be healthy in the long run, and the baby is going to be healthy when the baby comes out.
The stages of pregnancy, first, second, and third trimester, maybe how do they look like, and what should women expect during each stage?
Okay, now again, we just arbitrarily divide it, but again, it's like what happens during those different trimesters are very different. So first trimester is the interesting one from point of view. You know you're pregnant and you feel pregnant for majority of women. There are some lucky women who have absolutely no symptoms of pregnancy and look like the world is a bunch of roses. But for most of people is when you have the nausea in the first trimester, and that is the first 14 weeks of pregnancy. So they have the nausea, the bloating, the can't stand onions, can't stand eggs, I don't want to see fish, I can't drink water, I'm throwing up all the time. Now that's a typical first trimester.
So that's normal, very normal.
It's normal, but we also have people who really have very severe cases. So the worst case is what we call the hyperemesis gravidarum, and that's when they have vomiting, they can't stop. They're vomiting throughout. And the challenge is if you keep doing that, you lose salts. And when we measure your electrolytes, like your sodium, potassium, and you can actually get very, very sick to the point even you can have some problem even up to the brain because of this severe vomiting. So we have to even admit them, rehydrate them, balance their salt. So it can be very challenging for some women. There are other complications, first trimester that can occur, and that's why we do monitor. I'm one of those who's a fanatic of early ultrasounds to discover the location of the pregnancy, because this is where you discover ectopics, this is where you discovered miscarriages. Those are the type of complications. First trimester, so it will be the nausea and vomiting of pregnancy, the worst case being the hyperemesis that I mentioned, and the bleeding problems in pregnancy, and that we call that a threatened miscarriage, or even up to a miscarriage. So those are some of the issues you may experience in the first trimester. But if you're not having any issues, we thank God. It's not unusual not to have those symptoms. You're just one of those lucky people that don't seem to have the symptoms of early pregnancy. We move on to the second trimester. That will be between 14 to 28 weeks of pregnancy. This normally for most women is the best part, because you know you're pregnant, but you don't feel pregnant. The nausea for most people, up to 95%, by the end of the first trimester, beginning of second trimester, it's a thing of the past, so no more nausea, hallelujah. We thank God for that. And as I said, you know you're pregnant, but you don't feel pregnant. So your bump is just beginning to show and just beginning to come out. This is when you actually experience your first fetal movements. So you find that for a first-time mom, maybe around 16, 18 weeks of the pregnancy, that's when they start perceiving the movements of the baby. I have a challenge with some of the old women. They're waiting for kicks. You know, you're told they're kicks. But the initial movements are something very, very slight. You feel like something has just passed slightly, or a butterfly. And everyone has in fact, I want to write a book on women's perception of first fetal movements, because everyone tells you something so different. I've heard everything from they feeling like it's gas movement has come out. Others tell you they feel worms. Personally, mine was I felt was a butterfly moving inside my stomach. So it's so funny how women describe that first movement, but I find it very interesting. Then, so this is a time, at the first, I forgot the first visit, I like to have what is called a birth plan with the woman, because especially if she's going to be having a private delivery, it can be a huge undertaking in terms of cost. So deciding, is she going to a private facility, is she going to a public facility, and if any emergency occurs, what hospital would she like to go to? So it's always good to have a birth plan with the woman. So if they haven't tied that up, we do that. A lot of the vaccines, a lot of the tests, you find you've done, say, maybe your HIV tests.
That's during the second?
All that we do, okay, like the screening we do in the first trimester. And at every visit, we normally are going to check things like your blood pressure, your pulse, a urine test, just to monitor and ensure that you're doing fine during the pregnancy. So let's just say we found somebody was HIV positive in the first trimester. We normally are not going to start medication until the second trimester. So that's after 14 weeks of pregnancy. So that's the time when you can really initiate. So if you're finding that there's anything unusual, you initiate some form of treatment at that point in time. So it's very interesting, but I say so now if they haven't decided on a hospital, because they can still move around, they're not heavy, or not having those issues of I can't move, I can't sit, can't breathe. Walk around, enjoy yourself. We're advocating now more for pregnant women to exercise. I know previously it was more a relaxed approach. Let's relax, but we're actually advocating that pregnant women should be more physically active during the pregnancy. And this, since I've started doing this, I've noticed I'm having quite a number of people having very successful normal births just because of that. So second trimester, really nothing much happens, just the baby's growing, movements start, and we continue the visits. So we normally see women at least once a month, and they can continue with the supplements that we give them during pregnancy. Right.
But then there are a lot of changes, emotional changes and physical changes during pregnancy. And for a first-time mother, it can be overwhelming. Maybe what are some of the changes that a woman should expect during pregnancy?
Okay, hormones are one of those things whereby I feel even just with the onset of the pregnancy, everyone's different. So there are those people who become more emotional, and I feel you'd notice it more in the first trimester. By the time you're in the second trimester, people seem to be more relaxed, more balanced. The hormones, some of them come down, so you find it's not as bad. The other time we're worried about hormones is after the delivery, because there's that change. Your hormone levels really drop drastically after delivery, so there's that type of imbalance. But normally you'd notice it more during the first trimester if she's going to have that instability, and she's getting sensitive and emotional about things.
Yeah, and the physical change, one of them is the weight gain. You know, is it normal? What is considered normal weight gain, and what should worry a woman? You know? Okay,
yeah. It's very obvious, and typically majority of women, especially those who are having the nausea and vomiting of pregnancy. And again, remember, you have the reduced appetite in the first trimester, okay? So actually, quite a lot of women actually lose weight during the first trimester. And they're all worried, oh, is it something wrong? I'm supposed to be gaining weight. I'm like, no, just relax. Let's just try to get how to improve your appetite, and just wait out the first trimester. Once the nausea and vomiting stops, you'll start gaining the weight. But on average, they should gain weight. Weight gain should always be between 1 to 2 kilos per month, not more than that. The entire duration of the pregnancy, a good weight gain would be about 10 kilos, max 15 kilos. If you're gaining more than that, then that would be excessive weight gain, and that's more to you. And it's really understanding that the weight gain is not just the woman adding. It's not that she's the one who's adding weight. This weight is your blood volume. Your blood volume will account to almost a liter, and a liter of fluid would be equivalent to a kilo. Okay, so if by the time the baby is born you find you've gained, say, 10 kilos, we can already say that 3.5 kilos of that is the baby itself. 1 kilo of that already is the uterus. Half a kilo is the placenta. Then we have another kilo for the blood volume, and we're already at something like about 6-7 kilos, and the rest is also you yourself have not gained weight. So maybe just something like slight 3. I've actually had some people who, for one reason or another, were looking after their weight very well, and they actually had, by the time they gave birth, it was like they've actually lost weight during the pregnancy, but that's unusual. So it should nothing. If you're gaining 1-2 kilos per month, that's an adequate weight gain. More than that is not so good. First trimester, don't stress if you're not gaining weight. Yeah.
So how do you deal with that if you are, let's say, in your second trimester and you realize, oh, I'm gaining a lot of weight than recommended? Do you reduce your intake of food? Do you exercise more?
That's now we really have to look at. So what we'll look, and what I tend to, and these are the things which I've said during the preconception counseling, you've gone through their diet, exercise, and all of that. So those are stuff you've already gone through. So it's just a balanced diet, and they look at weight gain, especially weight gain, look at carbohydrates. Look at carbohydrates. So try to do more vegetables, and especially the leafy green vegetables. The beauty about leafy green vegetables is that they have, they make you feel full, but they have minimal calories. Unless you're cooking like us, Wajualuas, and I've put half a packet of fresh cream in everything. Obviously, the cream is the culprit. But if you're just cooking normally, lightly frying or even boiling, vegetables really have very little caloric intake, so you're not going to get weight. So it'll just be to look at their diet. Again, we'd also have to look at, is this somebody who has a family history of diabetes? Can we check? We normally, again, in the second trimester, we do a special test to see if this woman is developing the diabetes of pregnancy. So pregnancy is one of those conditions that can actually predispose, that you find that the glucose, that is the sugar metabolism, gets distorted during the pregnancy. So that could also be another reason. Again, preeclampsia, because they're retaining a lot of water, so they actually seem like, so that's the high blood pressure during the pregnancy. And you can have those who have the early onset, and because of that they're gaining weight. So we just look at it. Is it the diet, or is there something else that's causing this excessive weight gain?
Yeah, and you mentioned the importance of physical exercise and fitness during delivery. Maybe apart from helping with during delivery, easing the process and also the weight gain, do we also have benefits of physical exercise during pregnancy?
Definitely. As I said, for the delivery themselves, even how she bounces back post the pregnancy. I have a patient who, like, the next day I was like, "Ay, Kwani, why you I be sharing us?"
Yeah.
She looked like she has never even carried a baby, and just like, wow, it was so amazing. So maybe it's her genetic predisposition, I don't know, but we thank God. But she's also somebody who was quite physically active, so I think also that that helped. And even just for any person, it does not harm to have a good level of physical activity.
And let's talk about what a woman should not do during pregnancy.
Okay. Now, I'm one of those doctors. I'm not a don'ts. I'm moderation. For me, do everything in moderation. The don'ts, I think we discussed, very, very clear. So it's the alcohol, smoking, illicit drugs. Those were very, very clear that those we shouldn't be doing. But for everybody now, you tell them, don't take spicy food. You're in the first trimester, and that's the only thing that can pass your throat. Now, do I want her to starve? Do I want her to eat something? So we'll tell her, like, maybe minimize, don't have to have so much, but at least if it's going to aid and help you to eat, can have a little bit to at least make her be able to swallow something. So, but I'm one of those, whatever you do, do it in moderation.
All right. In case of some, let's say, complications, unhealthy complications, what are some of the possible causes for complications during pregnancy and any early signals for that?
Okay. Now, and that's the challenge. And there are some complications we cannot see them beforehand, that they're going to occur, whereas there's some complications that you can easily pick up. For the patient, you find your blood pressure is elevating. Unless the blood pressure is really, really high, you may not get headaches, you may not get visual disturbances, you don't feel that there's something wrong with your blood pressure. And hence the importance of the clinic, because it's a routine test. We just check your blood pressure, and I can tell you this is normal blood pressure, this is elevated blood pressure. The blood pressure is elevated, okay, can we do X, Y, Z? And can we keep it under control? We're not able to keep it under control. What are our other options? Can we do something so that we don't lose? Because it's one of those really, really bad obstetric emergencies. A woman can die because she develops what we call eclampsia, or even that high blood pressure, we call it, of pregnancy, we call it pre-eclampsia. They have some severe symptoms. It can knock off your kidneys. It knocks off all systems in your body, and it can eventually lead to death. Whereas if this was somebody who was being followed up regularly in the clinic, it's picked up early, and we manage before she gets any severe complications. And it's the beauty of working in both the public and private sector. And we are having discussions with my colleagues at work, and you find to get a woman in the private sector who's having severe symptoms because of this high pressure is very rare. Whereas in the public sector, you find that almost on a daily basis, you're losing somebody because of this complication. And the only difference is the frequency of monitoring and the level of expertise that women are being offered, so that we are not seeing in our private clients these bad complications, whereas in the public clients, they're really getting bad complications. So it's how to reach women, and I thank you also for having this program, to just encourage women, please, you're pregnant, and please don't imagine that because you've had a second child, a third child, you don't need to go for clinic. Things change, and you get a complication because of age, okay? So you find age, an older patient is more likely to get the high blood pressure, diabetes in pregnancy. So clinic is very important regardless of the number of pregnancy. The best clinic attendees are always the first-time moms, because we don't know,
Yeah.
we want to go to clinic. But the moment we've had a first baby, wanapima tu, it's like even you know what they're going to do. Watapima tu pressure, alafu watakwambia pima, watafinya mtoto, alafu naambiwa enda nyumbani.
Yeah.
You don't know that blood pressure monitoring can save your life.
Yeah.
Yes.
Okay.
So
I actually wanted to ask about that, but I'm told time is not on our side, but not before. We've talked about the mom, but not the child. Maybe you can leave us with a few tips on taking care of the baby while he or she is still there.
Attend your clinic.
Yeah.
Will give you the right guidance.
Yeah.
And for you, it's, as I said, we start the supplements before pregnancy. We take most of the blood boosters during pregnancy. And just live a healthy lifestyle. Look after yourself.
Yeah.
Baby will be looked after by God.
And when you look after yourself, you've looked after the baby.
Yes, automatically.
Okay. And something I'm taking home, like when you're eating, you're not eating for two.
No, we don't believe in eating for two. At least I don't believe in eating for two.
Okay. Okay, Dr. Ari, thank you so much for your time. We do appreciate that's all the time we had for the show tonight. Many thanks for your company. I'm Purity Museo. Do enjoy the rest of our programming and good night.